Today's webinar titled Cancer Centers in the HIE, Finding the Data for Survivorship Care Plan. My name is Scott Mash and I'll be serving as your behind the scenes host today. You can ask questions at any time by entering them into the chat box or by raising your hand and unmute you. Now, I would like to let you know this is the first time we're using Microsoft Teams to host an event, so you know that we may have a little speed bumps along the way, but we'll get through it. So to get us started, I'm going to turn it over to my good friend and colleague, Ms. Kathy Costello.
Thanks so much, Scott. Hello, everyone. Thank you so much for joining us. This has been just a wonderful project to work on. We hope you find it helpful for your needs as a cancer center specialist. But let me show you about the grant and what we were doing, because this grant was from the CDC. And so what we're hoping to share with you as a result of this is how to find oncology records from both inside and outside Ohio that can support your data needs for your cancer registry or for treatment. We also have created with everyone who's presenting today their expert guidance on creating an oncology guide on how to use CliniSync's HIE community health record to find the data and be very specific about the needs in oncology centers. And then give you the opportunity to talk to these really first-rate minds who deal with oncology issues within the state of Ohio. So Scott, let's go to the next slide and look at the actual underlying CDC grant. This grant, we've been 3 years in the making, and we actually have people on the call who, you know, were partners with us way back in year one. Marietta Strecker Cancer Center spent all their time educating us the first year on everything we didn't know about cancer centers and oncology data. So we really appreciate that. Wendy Waugh, who you're going to meet in just a minute, helped us through year two. And these people that we're going to introduce to you right now are all part of the year three program. So this grant is going to be closing out, but it has been really fabulous to work with the Ohio Department of Health in administering this grant and with all the information that we've received from the field on oncology care. So I just want, before I turn it over to our first major presenter, I want to have our other presenters, as I introduce them, just give a little wave so that you know who you'll be hearing from for the rest of the meeting. So Wendy, you're the first one appearing on my left. Wendy Waugh is the director of the Cancer Center at Southern Ohio Medical Center in Portsmouth, Ohio. And right next to her is Barb Saylor. And Barb is the director of the Summa Cancer Institute in Akron. I know I'm just giving one site. I recognize that there are other field sites, but Barb, and then Pebbles Thornton from Genesis in Zanesville. And I didn't introduce them all individually because I just want to say collectively, the thing that struck me about these people is these are three directors from three different cancer centers who have devoted their professional life to oncology care. If you look at their credentials on this page, it is just amazing. And when we began working at the beginning of year three with these three cancer centers and these four ladies, because we'll be introducing Melissa in 1 second, it was like it was an ongoing discussion because they were so knowledgeable in the issues of data and the needs of cancer centers and the whole approach to cancer care and survivorship that it was just a joy to work with them. So hopefully, as a result of what has been done by them this year, it'll be information that will be very helpful to you all going forward. So our first presenter is Melissa Smith, and Melissa is the is a manager of the Cancer Registry and Program Accreditation for Summa Health. And Melissa is, I have to say, our super user when it comes to using the community health record, which is our longitudinal health record. I imagine many of you are familiar with it. But it is that combined record of what's available in the patient database if you have to query. So Melissa became our guiding star and actually educated all of us on things that we didn't know. And so I'm glad that she is going to be able to share that. But Melissa, before we start on your technical presentation, Scott, why don't you go to the next slide? Why don't you give folks a little better understanding of the Summa Cancer Institute in what you all do?
Okay, can you hear me okay?
We can, yes,
okay.
Thank you.
So we have 3 facilities, and we have the Cooper Pavilion, we have Parkview, and then we have Medina Medical Center. We treat more than 100 types of cancer. We specialize in breast, colorectal, gynecological, lung, urologic, hematologic, and head and neck cancers. People can go to any of those centers to be treated. And the Summa team provides every patient with personal, dedicated, and multidisciplinary team of cancer specialists. So, we're throughout Northeast Ohio.
Thanks, Melissa.
Thanks.
Scott, okay, we're going to kind of break the presentation into 3 separate areas. One is to let you know where the data comes from that you will be querying if you go to the community health record to look for some of your cancer patients in their data. The second area is going to be with Melissa, who's actually going to be your guide in going through the community health record to show you how you can customize the view and find data both quickly and data you probably weren't even aware is there. And she'll show you how you can access that and use it for your data registry needs. And we then are going to look at some specific use cases. Wendy has a very unusual story that she's going to share about the data and how connection with the HIE was an important part of their cancer center over the past year. So let's start with, where does the data originate? What is it that you will be seeing if you would query for one of your patients? So Scott, next slide, please. Okay, many of you who may deal with CliniSync may have seen a similar slide in the past, but let's break it down and talk about what happens with the data. So CliniSync overall as a network has information available for 18 million patients. Now, it isn't something where we have a data warehouse and, we're located on some huge, center and with 100 million computers running and stuff. It's rather that we maintain the master patient index, which allows, and the record locator service, which allows when you query us to send that query out into the field to everyone we're connected to and to say, bring back any information you have on this patient. And so that is our model. And because of our widespread participation, it gives a very rich layer of data that gets returned to you, because we have 156 hospitals who participate. A huge amount of information comes from the hospitals. We'll look at that in 1 second. And probably 15,000 independent and hospital employed providers, over 500 long-term care sites and post-acute care, including home health and hospice. And we do work and support the health plans that operate in Ohio to help them with their attribution lists and stuff. And we are connected with over 80 different EHR systems, vendors. So you can see the network effect of what we do. And that is important because that kind of sets the table for what you all are interested in knowing, and that is what can you get if you query what is going to help you with your patient treatment. So Scott, let's look at the next slide, please. So if when you hit that query button and you put in your patient identified information and bring it back information, if it's coming from a organization who participates in the CliniSync HIE, then that information comes back in a unified package where it's called the Consolidated CCD, or Community or Continuity of Care document. And that is then presents by individual encounters, so that every organization that has contributed data will be identified separately. You can go to a specific hospitalization. If a patient's been hospitalized 3 times in the past year, each one of those encounters will show up separately. Now you can combine the information into one master file, and Melissa will talk about that. But, you know, basically what you're looking at is all the, if it's hospital information, it will include all the information that the hospital is contributing to us about that patient's care. It will include the admission and discharge information on that patient. It will include, besides, at the very minimum, it would include diagnoses, allergies, meds, and demographic information. But I would say virtually every hospital, especially in this days of information blocking, everyone is very transparent in Ohio and contributing virtually all their data. And so we get lab results, we get imaging reports, we get all kinds of notes, nursing notes, progress notes, care treatment plans, and discharge directions. So there is a fair amount of data in the file for every encounter that shows up within our network. If it's an individual physician or ambulatory provider, what will come back is a summary of care, which is a summary for that particular encounter. Long-term care is the latest to join as far as contributing data, and that has just been this year where we have been able to integrate with their EHR systems. And when they contribute data, as the patient is moving from the long-term care site back to the hospital emergency room or inpatient, a document will be created with a summary of that patient's care at the long-term care site, or if they are discharged to home or to another facility. So those are all, that's all the information that presents to you from organizations within our network. But let's talk about outside the network, because of all the use cases that I feel it is really important to understand what other data is available. I would say oncology has to be one of the big drivers here, because it is so frequent, and you all can educate us on this, but I would say that it is common. I can't say it is the most common model, but it is common to have a patient maybe go outside the state, depending on the type of cancer involved, for some type of diagnostic workup or possibly procedure done, and then come back into the state for follow-up treatment. And so this type of information, the flow back and forth, it's really important to understand how you can get that data, whether it is a hospital or a cancer center outside of Ohio, or if it's a hospital or cancer center within Ohio but not part of our network. That information will still be available to you. And so that's what you want to keep in mind. And Melissa is going to give the gold standard, which is how to access VA data, which I think is really critical. That's what we heard from all the cancer centers. This is like the missing piece of the puzzle, and that is also available. So this is all within CliniSync's network, but let's see outside CliniSync's network what comes to you. Okay, go on. So the way this works is you, as I said, you will query the patient, and again, Melissa will walk you through that. But when you hit that query button, you'll have the information that comes from within our network, but our technical message then flows also into the national network and pulls back any other data from any other system that has organizations contributing data to them. So let's look at that network, because I think that's probably an important part for you to understand. And then we'll turn it over to Melissa to talk about how it actually presents within the HIE. So Scott, why don't we go to the next slide? This is really the bread and butter when you're talking about being outside of the CliniSync network, because for those of you that follow where interoperability is headed at the national level, and you hear the terms TEFCA, and you hear care quality and e-health exchange, those are all part of what is being built, and that is a national network of HIEs. And I would say we're really fortunate within the past few years that this has become a reality, and more as organizations join one of these national networks, it does make that data interoperable. But for your purposes, there may be organizations that you are not aware are accessible when you query for a patient. So on this diagram, if you look at the top, it's CliniSync. So let's say the information is originating, or your query is originated with CliniSync, and we pull in our information, but then it flows through to, that is the abbreviation for the e-health exchange hub. And the main thing I can tell you about the e-health exchange hub is it's like the traffic cop for all these individual HIE networks nationally. And e-health exchange, the interesting thing about it is it was originally envisioned, I don't know, probably 8, 9, 10 years ago, as being the connection between the private industry and the federal agencies, because there had been no connection piece between that. And so whatever is being done at the VA or the Department of Defense, or for Social Security or anything like that, it was remaining within the national or within the federal system. Whether or not they talk to each other, it was not moving outside of the federal network. And so what you have here is the first time when the e-health exchange came about, that you married those two areas. So you're looking at the public and the private side of the network. And because it was created the way that it was, all that information from the VA and the Department of Defense, and as more and more agencies come on, other agency information, but certainly those two big ones, is available to you every time you query, as well as any organizations who are connected through Commonwealth or Care Quality. So with that, that's a kind of short primer on where the data comes from. But I think what you're all interested in hearing is what Melissa has to show you, and that is how do you go about accessing that data in a way where it's efficient and produces the results that you want. So with that, Melissa, I'm going to turn it back over to you.
Thanks, Kathy. Okay, and as Kathy stated, there is a guide that we did put together that is going to be made available. So you don't have to remember all the steps that I'm going to talk about here in a minute. Next slide, please. So I see that we do have a lot of cancer registrars on the line today, and we do use the information from outside facilities for the cancer registry information. For every patient, we have to collect demographic, medical history, any diagnostic findings, information on the cancer, treatment, and then also yearly follow-up. And depending on the reason that the information is needed, CliniSync can be utilized to obtain this information from outside facilities. I have found it's a great resource. We in the Cancer Registry will use CliniSync for most of these things from other facilities. Next slide, please. So in the very beginning of me being part of this team, I found out that we actually could have record or access to the VA records. cancer registrars are always trying to find information from the VA. We were always told, you can't get it, we're not going to give it to you, it's not available. It was very trying at times. We were never successful. But talking to Kathy, she's like, oh yeah, VA records are in CliniSync. And I was like, no way. So that was a game changer for me. And then in addition to the VA records, you can also obtain Department of Defense and then the facilities outside of Ohio. And I'm sure that they'll be very helpful to hospitals that are close to the borders. And getting to those records is pretty easy. So when you first log into CliniSync, you'll log in by entering name, social security number, date of birth. Now, I typically click on advanced search, so then you can put in name and date of birth, but you can do it either way. And then once you get past that, it will bring up the next snippet in the slide, and you select your reason, and you will choose the clinical non-emergent reason. Next slide. And then once you click on your reason, you'll then click on access additional records, and then you'll click on the patient. You will then click documents, and then click on your find external documents to find any of the ones that are external, like the VA, DoD, and outside facilities. Next slide. So then if there are records, it will come up and you'll click on the checkbox. You'll choose your time frame, and then you can click on Find Patient Documents. Then you choose the documents that you want to load, and then at the bottom there you'll see you click on Load Selected Documents. Next slide. And then once you do all that, what will come up is a comprehensive CCD, which, as Kathy said before, the CCD is your continuity of care document, and that will come back up under the Documents tab. Next slide. Okay, and then from here, you can do one of two things. You can either download your document, and then you can save it as a PDF if you want. If you save it as a PDF, if there are certain pages you want to print, you can print from that if you don't want to print the whole continuity of care document. Or you can go ahead and print the document, and depending on your computer software, you'll be able to print to your local computer, or as I said before, you can also print to PDF from there also. And then you can save your document, print your document, either way. Next slide. Okay, so that's how, it's pretty easy. That's how you find the VA documents. I just tested it yesterday again with a coworker of mine, and sometimes it does give you an extensive record that you kind of have to go through, but it is very nice to be able to get those records. One of the other things in the guide that will be available is how to locate other patient results for those facilities that are within Ohio when you don't have to go and find external documents. So say we want to look for lab results. On the far left, you'll see under patient summary, you'll see things like encounters, results, medications, documents, and referrals. So you will click on the results tab in that far left column, and the results will be sorted by date received, And then each line will identify the type, description, the alerts, the ordering provider, the facility, and the status. Next slide. Okay. And then this slide just kind of tells you, kind of breaks up the status, the type, the keyword, the date range. You can click on those filters, say you only want lab, you can unclick everything else, and you can filter exactly what you're looking for in the results tab. Next slide. You can also filter by your date range. There are last 30 days, last 3 months, last 6 months, last year, all records. And you can filter whether a patient's seen, you want inpatient, outpatient, or ED records. I typically choose all records just so that I can see whatever is in there, but you might have, you might know exactly what date you're looking for. You might just, click on last 30 days or a shorter time frame than all records. Next slide. So then what comes up is the name with the results underneath, and clicking on the name of the test will bring up the complete report. So that is on the bottom right. There is the complete report from what you clicked on. So that's just looking at lab results, but you can find, any other result the same way, whether it's, radiology results, transcribed reports, things like that. So that's how to actually look for results in CliniSync. The next slide, please. The other thing that you can do is you can actually customize your view. So you have like a quick view for the reports, lab results, and imaging studies that you typically look for. To see them simultaneously when accessing the community health record, you customize under the patient summary. So when the patient summary page is open, you go to the upper right-hand corner, and there is a configure button to set up the patient summary view that you desire. So you'll see on the far right, there's the configure with the little settings wheel. If you click on that, that'll bring up the way to configure your results. Next slide. So here, what you can do is you can choose which sections you want expanded, or you want hidden, or you want collapsed. So you can, hide, say you don't want to see allergies, you can hide that, or there's anything you don't want to see, you can hide. You can unhide at any time too, by coming back to the configure. If you're like, oh yeah, I shouldn't have hidden that, you can come back. So I have my reports expand. All my reports are expanded, and then everything else I have is collapsed, because reports is typically what I'm looking for. And you can still get to those sections when you need to, but when the summary page comes up, the report section is expanded for me. And then you can list 10 results as the number of reports you reviewed. You can hit the save button when you're satisfied with your review. And then next slide. And then this is what it'll look like when it comes up. So you've got from the slide from the last section, the results, the reports, and the procedures were all expanded, and everything else was collapsed. And then we said, show the first 10 results. So that's what will come up every time you open, will be the results, the first 10, reports, the first 10, and then procedures, your first 10. Next page. And then just as a note, so the same view for the patient summary will appear each time until you modify it again. And then changes, as I said, can be made at any time. You just go back into the configure. For fields not displaying in the patient summary, you can still always access the information from that far left side where you saw the encounters, results, medications, and documents tab. You can always get to that. So if there's something that isn't expanded on that page, you just click on that far left, and any of those tabs you can still click. And then next page. So when I first arrived at Summa back in 2017, I contacted our IT department to get access to CliniSync for our cancer registrars. I was actually the very first person in the system to be granted access. And the person from IT told me, she's like, we didn't even know who would want this information. But, you know, I said, oh my gosh, it's like a wealth of information. So it'd be beneficial to like anyone in the cancer program. And so I have actually granted access to physicians, physician office staff members, social workers, dietitians, our nurse navigators. If you have lay navigators, maybe they would want access. And then, of course, our cancer registrars. And, you know, all of those people have accessed CliniSync and have utilized the information that is there. Next slide. Okay, so that is all my information. So I'm now going to hand it over to Wendy.
Thank you, Melissa. And it's just it's so cool to see how CliniSync works and all of the information in CliniSync. And I just feel so lucky that I got involved in this project. And I just wanted to kind of talk about a little bit how it affected SOMC, that the things that you don't know that you figure out just when something crazy happens. So here's the thing. On November 11th, 2021, our organization experienced a cybersecurity attack. Within that cybersecurity attack, our whole EHR, actually more than our electronic health record, phones, faxes, communication, email, everything that you would do, even including our HR records, was shut down at like 5 a.m. in the morning. So it was a struggle because patients were scheduled, staff was scheduled. You can just imagine if the lights go out at 5 a.m. and you cannot access anything. And that's what happened to us. So being in cancer care, we had people that were in the midst of day 3 of 4 of chemotherapy, on radiation therapy treatment, and we had no way, because we were completely electronic, to know what we were delivering, what those orders were, what patients that we even needed to call to say not to come today. So we scratched our heads for about a couple of hours, and somebody said, you know what? We send our physician dictation to CliniSync, and is there any reason that we cannot get into CliniSync and download the face sheets on patients and at least start trying to figure out which patients were on what therapies? Luckily, we had a pharmacist who had printed out schedules the day before of the people that were scheduled for chemotherapy. And we had a radiation therapist who had printed out the current radiation therapy schedule. So we had some insight as to who we might need to get a hold of. but we use CliniSync exclusively to download path reports, physician notes, everything. And within 2 days, we were able to bring our patients back in and get them on schedule and back into treatment. And the whole hospital was actually down for a little over 2 weeks, which is not, it seems long, but it's short with some of the other cybersecurity attacks that have happened across the nation. Sometimes it's 6 to 8 weeks before you can get your system back. But just know that all of this information that Melissa has shared and how important it is, number one, to share with an HIE, and number two, think of it as a resource and a repository for where you can get these records if you need them. It's a backup.
Thanks, Wendy, for sharing your story, because I think all of us, when we all got together as a group, I could see the eyes light up of your compatriots there at the other cancer centers, because when you're saying the ability to access data that you thought was lost, and you know, for patients where it's not possible to say to them, oh, well, we'll just do this next month instead. You know, that is not a good response in cancer treatment. So I do think that that is a really valuable takeaway, not just for cancer centers, but for everybody in this day and age. Unfortunately, we all are, you know, learning all that stuff about cybersecurity we never knew and wished we didn't have to know, but we all need to know it. And I think that's one of the best lessons. And unfortunately, SOMC was not the only site in Ohio that had experienced, you know, that type of downtime. But, you know, it is a good way of stepping in, is to make sure that your records are there and you can rely on them to get
right.
Historical.
And what I really want to focus on is this is a chance, or this is when CliniSync made a difference in the lives of patients. So, you know, we think of it as a record repository, but this was a true example of when CliniSync could and did provide the information that we could onboard those people and keep their treatments going.
You know, as I told you at the time, I think our technical people were so touched to realize that their work is not just, you know, what can we integrate, but the fact that they can help individual patients and, you know, receive better care and treatment. So that's wonderful. So with that, what I'd like to do is open it up. Scott, if you could go to the next slide. We've been really, as I said, just really fortunate to have all these folks as our technical experts this year. And I think they all have brought such good perspective to what is being done in cancer care overall. But I'm going to ask Pebbles, I think I'm going to start with you to talk a little bit about what Genesis is doing, and then Scott, if you want to go on to the next slide. And just what do you see as the greatest advantage in partnering with a health information exchange?
Yeah, absolutely. So, you know, this question came up during our last kind of pre-meeting, coming to this culmination of presenting the information to you. And we looked at it from registry's perspective of, you know, having to find the information if the patient's diagnosed at your facility and they go to outside facilities. Trying to obtain those records can sometimes be quite difficult. We also looked at it from a survivorship care plan perspective. If a patient is getting their treatment at different facilities, of being able to access those results. But the main thing that really stuck in my mind was, you know, we have those patients who are snowbirds here in Ohio that go down to Florida for 6 months of the year and then come back here, and they get treatment in both locations. And you know, for those of us that have had Epic or have Epic, the interoperability with other Epic facilities is amazing because you can look at outside records immediately from those facilities. But if another facility does not have the same EMR as you, then CliniSync really fills that gap so that that continuity of care for patients stays there. So we can see what treatment they're on, when they last received it, what their labs were last, and then it's a seamless transition for that patient. If a patient is being referred to the facility, instead of having to wait for all of those records to be faxed and go through them, you know, this is an opportunity for us to be able to go on and pull those records immediately and get them scheduled. And it helps because we all know that in cancer care, a week is a long time. It's a very long time for patients. And if you have that gap of waiting to get records and then schedule them and, you know, go on, anything that we can reduce in that time and be more efficient is extremely important in their journey. And this is something that will help with that efficiency and cutting down the time. So it just, I can see it being utilized in many, many different ways. Kathy, you're muted.
Sorry, I'm muted.
Okay.
What I was going to say, thanks, Pebbles, for your insight. We have a couple of questions that came in before we turn it over to Barb for her thoughts too. So do you want to go ahead and?
Yes, ma'am. First question is, so what happens going forward? Will access be provided to all hospital cancer registries, or does permission need to be requested?
Good question. Thank you. If you are if your organization is currently a participant with CliniSync, yet you're not sure who the administrator is of our contacts, because every organization has an identified person who kind of manages the access. If you're not sure, you can go to our website and type in a question and we can let you know. We can connect you with your administrator, and then they are the person who would give you access. Or if you have any problems, certainly, you know, reach out to Scott and me. We're both listed on the last page, and we can again connect you to the correct organization. But Cancer Center, the way that when we set up CliniSync, because it's been over a decade now since we've been in existence, it was done with the idea that every treating provider should have access to all the data. And so we've always operated that way. And so in given organizations, what we've found is that the organizations themselves who have participated with us for 8 or 10 years never could have envisioned how all the data could be used. And so it's something that you may want to go back and reassess for your organization and see where else, like the Cancer Center, access could be most meaningful. And you, at any time, you can expand the people who are given rights to access the information. So
that kind of goes hand in hand with the next question. And I see our facility is listed as a participating hospital. However, the system's not being utilized. Who can we contact to learn about login information?
I'll tell you, just go ahead and email Scott and me, and we will make sure we have field reps all across the state of Ohio, and if someone in your region will contact you directly and make sure that they connect you. And if for some reason, see, the other thing, since we've been in existence a long time, sometimes the contact person at the organization has changed. And so this will help us focus on getting back in and making sure that the organization is up to speed on who their various contacts are. So,
next question is a little technical, and I can take this one. It says, if our users query the community health record from within Epic versus going to the CHR portal, can they see all the data there? And it does work a little bit differently with how we respond to queries. With Epic, if you query the Epic network, we are a node. We appear as a node on the Epic network, and we respond back with all of the data that we've collected on that patient from non-Epic hospitals. And we only respond with the non-Epic hospitals so we don't duplicate data. And also when we respond, we limit that data to the last year. So you're only going to see a small subset of the data when you query from Epic. But if you log directly into the Community Health Record portal and query a patient, you will see everything we have with no time limits wrapped around it. So, you know, we try to do that so that we keep those the queries efficient, and so we don't overload your EHRs. All right.
Thanks, Scott. He's definitely our technical guru on these webinars. Do you have another question?
We have a couple more questions.
Let's have Barb interject before, and then we'll come back and do the rest of the questions. Hey, Barb, I can see you're muted, but if you want to hop on, Barb again is one. I feel we're so lucky to have this group to work with, but as you can see, Barb has done this for her whole life and has really good feedback on how cancer centers operate and what can be done more efficiently for the purpose of the data. So Barb, for you, what do you see as the biggest advantage in being able to work with a health information exchange?
Well, first of all, can you hear me?
Yes. We can hear you, yes.
Okay, I never know.
I know.
Well, actually, I can say ditto to what all of you have already said as presenters today. The greatest advantage for us at Summa in partnering with a health information exchange is that it impacts our patients' care. We're able to retrieve patient and treatment information more quickly, accurately, and in a consistent manner. It's all at your fingertips. There's very little need to make phone calls, send letters, fax, send emails. So this is just an awesome tool, an awesome resource to help facilitate the care of patients across their cancer journey. Using the information at Summa, we have utilized distribution of our survivorship care plans. Survivorship care plans are not mandated by the COC, although if you have a breast program, it is mandated in that particular program. But we at Summa feel that all patients should have survivorship care plans. So as Melissa stated, we utilize this quite a bit to complete those. And we have given access, as she said, to several different disciplines so that they can complete their component of the patient's care. When we distribute the survivorship care plans to patients, we utilize the care plans in such a way that we're educating the patients and their families not only about the care that they received and what to look forward to in the future of the survivorship world, but we also take the opportunity to continue to discuss our support services, the classes that we have, providing other resources that they may need, and to discuss our ongoing support groups and exercise therapy for them. So this is just a huge resource, and I can't see living without it. So I guess that's my 2 cents.
Thanks, Barb. Worth a lot more than 2 cents, that's for sure. But anyway, let me just, one thing Barb kind of made me think about that I just wanted to say before we go back to the questions is what we've seen when the HIE started, you know, we kind of operated as one big conglomerate because none of us really knew what all the use cases were going to be. And all of our field reps were like, hey, look, we have this wonderful database here. Go forth and multiply as far as the data. But we didn't understand how to make it efficient. And what we found over the past 5, 6, 7 years is that when we sit and talk to groups like this group right here, where there's a specific need, you can educate us as to how we can help you message and complete getting that data into the system. So for example, we have had now several hospitals, but one in particular I can think of in the southern tier of Ohio that had many, many nursing homes that they dealt with, that they were, the question of faxing data over and phone calls was really a problem for them. I think they counted that they had 2.5 FTEs doing nothing but coordination with patients who are being discharged to long-term care. And over a year and a half, one of our people went out and worked with all those various sites and worked with the hospital in their education around those long-term care sites. And the hospital was able to convert from having to produce faxed records, which, as we all know in this day and age, is always a HIPAA kind of issue too, as to who is looking at that. But the fax or the phone calls were cut down so significantly because they made use of our field people to educate the long-term care as to the information that they could find in the community health record. The discharge people were making sure all that information was in the CHR and then was flowing for the long-term care. And the long-term care they were so thrilled because the information was flowing so much more quickly to them that they did not have to wait to get information and get the patient started on care. So that think about that when you're refining your own workflow, to make use of our folks to go out. If you have an identified provider or group of providers or type of provider that you need to work with and you do want to make it electronic, let us know and we will set up joint education with you and make sure that that information gets out into the community. So, Scott, what other questions did we have come in?
The next question is there an easy way to see if another facility has posted or shared records on a patient?
I can't say by individual patient other than querying that, but if you want to know generally, there are certain organizations contributing records to CliniSync. Our whole system is very transparent. Just go to our website. It's listed on the last slide. And we actually have a section called For Members, and you can pull down those that tab. And what you will see there is a list of all the hospitals, all the organizations that contribute data. For the hospitals, it'll specify what type of data they contribute. For the ambulatory providers, it will tell you which of the which provider groups are contributing. So hopefully that will help speed up your query as to where to find data. But if you're asking for a specific patient, can you find out, you would have to query that patient within our system. And then it will present, as I said, you can present by encounter, so you can see right away which facilities have contributed data. And then you can go to that specific provider's record and find out what is in that encounter.
Melissa has her hand raised.
Melissa?
So just to add to that, so when you do bring up a patient, that the first page that comes up, it'll have the facilities and each one of their medical record numbers. So you can typically see if you've got Summa records or Cleveland Clinic records, or it doesn't always come up, but typically you can see each facility right there, and each facility has a different medical record number. But if you click on, say, if I'm at Summa, but I don't want to see my Summa records, but I can still click on that, that medical record number, but everything will still come up from every facility.
Thanks, Melissa.
I don't know if that helps.
Yeah.
That was our last question.
The person who asked that, do you have another follow-up on that, or are you okay on that? So with that, it looks like we're wrapping up. Let's just do one last roundtable and ask everybody about why interoperability itself helps you as a cancer center. Because let's face it, all these people have worked in the cancer area way before the time that CliniSync began. So they have had the paper record perspective and they've had the electronic perspective. So tell us just generally, real quick, what do you think interoperability has given to you as a cancer center in the care of your patients?
Well,
I'll start.
Oh, go ahead.
Okay. I'll start and just say, from the administrator perspective, I would say efficiency. So before, our staff that were gathering records would need to potentially fax and or wait, call, and then you would be dependent on the busyness of the physician office or wherever you were trying to get the records from to get to you. And so now the staff can, when they have time, go out and get it and load it. So efficiency, that's my answer.
Okay, am I up?
You are, Barb, go ahead.
Okay, clinically speaking, I feel that this is best practice for care coordination. I mean, when I think about years ago, decades ago, the things that we had to go through to get information and pass it on and to have it be efficient for the patient's care and not waiting 6 months, we have come a long way. So I would say this is best practice for care coordination.
Pebbles, what about you?
Yeah, I agree with both of the ladies previously, but I would also add safety in there as well. Now that you can see what patients have gotten elsewhere in pathology, this is a huge push towards safety for the patient.
Great. Melissa, any last thoughts? I know we have another question that just came in, but Melissa, go ahead.
No, I kind of think kind of wraps up, everything that everyone else said. I mean, it definitely makes us more efficient in how we are trying to gather the information. And I can actually answer Lynn Giljohn's question too, depending on how much the patient had at other facilities. When you know what you're looking for, as Wendy put in there, when you know what you're looking for, it's actually very efficient and very easy. Some patients maybe go to a lot of different places. It might take a little more time to gather it, but so much more efficient than we used to have to phone other registries, send letters to other registries. We may not even know where the patient went. And so that information would go to the state of Ohio as blank. I mean, the state of Ohio can consolidate the record together, but a lot of times we would send that information blank because we didn't know where those patients even went. So it actually has helped the Cancer Registry to find the cancer specific information immensely.
Okay.
I wanted to just, and I know we're at time, but I wanted to add one other just word of caution. So I see that one of the people on the webinar has actually commented that they are a part of the community health record, but they don't believe that their organization is contributing, or what is the organization contributing. So I think that you cannot assume that you've found everything that needs to be found. Depending on what the organization does send and their processes at this point. So I think that we have to think about that as well. Just a final parting thought.
Thanks, Wendy. What I would say is, any of you who have questions about what your organizations are doing and what is being contributed, please contact us and we'll make sure that your local rep gets to you and kind of walks you through what your organization is doing. And with that, I can't say enough good things about the people that we've worked with this year. We thank you all so very much, and just feel the patients of Ohio are very lucky to have such fine cancer centers. So thank you all, and have a great day. Stay cool. Okay.
Thank you. Bye.
Bye.